Before diving in, we'll talk to a physician about how to stay safe as part of Black Maternal Health Week next on NBC News.
Turn heads in the totally redesigned Subaru Outback. Dog tested, dog approved.
Big Fat Tacos are back. Get 2 grilled chicken Big Fat Tacos for just $6. Only at Del Taco.
Tax Act is designed to help you get your taxes done. Let's get them over with.
Plan B puts me in control. That's for you to be.
Serious dictation was driving me crazy, so I switched to Whisper Flow. Here's why I'll never go back. First off,
In today's Daily Health, it is Black Maternal Health Week, and we are looking at how the system surrounding pregnancy, from fertility to postnatal care, can play an important role in improving outcomes, specifically for Black women. Studies show that for women of color, they face significant maternal health disparities, and according to our next guest, it starts long before pregnancy. Joining us now is Dr. Tia Jackson-Bey, a board-certified reproductive endocrinologist, infertility specialist, obstetrician, and gynecologist. So good to have you here.
Thank you for having me.
So there's so much that plays into maternal health care writ large, but talk specifically about what's driving these disparities for Black women and women of color.
Well, there are lots of different reasons why we see these disparities. These disparities essentially mean that there are differences in the types of diseases that Black women have, and the outcomes from different treatments, or whether or not they are treated appropriately. This can, range anything from what we call implicit bias and institutionalized racism, how these women are treated once they're in healthcare settings, but there are also differences in the types of conditions that they have and how they present to the healthcare system.
Like it can take longer for a woman to get a diagnosis.
Absolutely. It can take longer, sometimes because they're not aware or connecting the symptoms that they have, and also because their concerns are not taken seriously.
I appreciate that you say this all starts well before you start trying, right? What do you think women should know before they try to have a baby?
So I think the things that are important are just your overall state of health, where things are now, talking to your providers about your desire for parenting so that they can know in advance, okay, 1, 2, even 5 years out, what are some things that we may need to work on? Being aware of your own body and how it works. And, there may be medications that you need to change or different things that you need to address well in advance of pregnancy.
I love that so much. We plan for so much in life, for a new job, for whatever it is, but you should be planning around
Absolutely.
having a baby too. What can be done, though, to address some of these disparities that we're seeing in maternal health care?
I think there's a lot that remains to be done, and we're still trying to figure out why some of these disparities exist. You know, from my side, we do a lot of education of healthcare professionals about the fact that they even exist, but also about how you interact with different groups, what works best, what are the approaches that help. Support in maternity care, we are going to learn a lot about doula care and talk about that, but that is something that can be shown to change outcomes as well.
Yeah, so doing more training around for the providers. What can the patient do, though? Because so many times when you walk into that office, you can feel kind of powerless.
I agree. I think it's really important for patients to know that they have power. You get to choose your healthcare team well in advance of pregnancy. If you're not feeling heard by your provider, it may be an opportunity to find someone who helps you. You can bring support with you to your visits, including to your hospital for delivery. And I think that's a big part of the shift that we've seen recently is making sure that people have people who are important to them around them.
Regardless of background, what's your one big piece of advice for a woman considering getting pregnant or trying?
I think the thing that I want people to know is that you can have control and agency over this time. We want pregnancy to be joyful for you, to be happy, for you to be healthy and safe. And so all of these systems can work together to ensure that for you.
Really important conversation. Dr. Tia Jackson-Bey, thank you, especially on this Black Maternal Health Week. We appreciate it.
Of course, thank you.
Of course, and stay with us. We got a lot more news ahead. You are watching NBC News Daily.